Hi, everyone, and welcome to All Things Breastfeeding, the podcast that talks about happenings around the breastfeeding world. I'm Barbara Robertson. I'm the host of the podcast, and I'm joined by my Lacta co-founder, Nancy Mohrbacher. Good morning, Nancy.
Good morning, Barbara.
Well, Nancy, we have a topic. We are working on the next edition of Breastfeeding Answers, so Breastfeeding Answers third edition. Keep
Correct.
your eyes peeled for that 2027
Correct.
sometime. But we just went through our hand expression section ourselves when we were working on the chapter. So it really took a look at the research. And then I just did a talk on it for someone. So I really feel like we're kind of up to snuff with our hand expression information and wanted to share with you all kind of the latest stuff on hand expression. All right, so Nancy, we know from research that one of the biggest fears that families have is not worrying about not having enough milk.
Correct. And that is true internationally. And
Absolutely.
that's been amazing to me to see because I used to believe that in parts of the world where breastfeeding was the norm or at least more common, it wouldn't be such an issue. But I found out that's not the case. It's really true
Right.
everywhere.
It really is. And so one of the things that when we looked at the research, we found that people who hand express, and it could be maybe prenatally, we'll talk about that later, but also just learning the idea of hand expression prenatally, but then doing it postnatally, especially in the first week or so, really boosted confidence.
Mhm.
Yeah, and so what do you think's going on there, Nancy?
Well, I think that when nursing mothers or other lactating parents have their babies, the fact that they can control their milk flow
Mhm.
makes a difference.
It really, and it's like, oh, it's there because, we do have, when the baby's directly nursing, we can't see what's
Right.
happening.
Right.
But when we do a little hand expression, especially the colostrum prenatally or immediately postpartum, it's like, oh, okay, yes, yes, there is milk there.
Right.
So it's enormously reassuring. It helps people, the act of hand expressing actually helps us become familiar with our bodies, more comfortable with our breasts or chest. So, yeah, it just really, research shows it helps boost confidence, and we know that nursing is a confidence game.
It
So,
is.
all right. So what are some of the pros of hand expressing? Why would you do it? What are some of the advantages of it?
Well, for example, if breast pumps are of course very common,
Yeah.
but for many many new mothers or new parents, they might find themselves in a situation where their breast they don't have a power source,
Yeah.
or
Yeah.
maybe they've forgotten some of their breast pump parts,
Right.
or maybe like immediately after delivery they don't have access to a breast pump.
Right. And so, yeah, it gets rid of the whole stuff, having
Right.
the right stuff, having the right flange fit, which we've talked
Right.
about,
Right. There's no fit issues.
there's no fit issues.
Mhm.
Many people say it feels more natural,
Right.
whereas people talk about when they're pumping, they feel like cows and this, that, and the other
Mhm.
thing. But if it's your own hand, it feels more
Right.
comfortable.
And you
Um,
have the skin-to-skin contact as well, which
right.
helps to release the right hormones for milk flow.
So it just, yeah, it's free of charge.
Right.
That's another advantage.
Right. It's
As we
it's great
mentioned,
in emergencies
it's
because
great in
yeah.
emergencies.
So
Yeah,
it's
you don't
just a
need anything.
skill. I think it's a skill that every lactating parent, breastfeeding
Mhm.
mother should have.
Yeah, absolutely. And there are situations where a parent might be missing a hand. They might have carpal tunnel or reduced hand movement, and that could absolutely be the case. But for the bulk of people, they do have their hands and they have, working hands.
And it is a learned skill.
It
So,
is a learned skill.
it's not like you can just immediately do it and be successful. It does take a little bit of practice.
Right, and we're going to talk a little bit about some things that can help with that as well. Another thing is it's eco-friendly. Again, we don't have any, pump parts and things like that. And there's not necessarily anything to store or transport, especially if we're doing it
Mhm.
right into a teaspoon, give it to
Right,
the baby. And the only thing that you need to wash are your hands.
right.
Yeah, so, and hand washing is an important part of hand expression. So every single hand instruction for hand washing, I mean, for hand expression says start with your clean, washed hands. It's like,
Right. And of course, having a clean container is important too if we're
exactly.
pressing into something.
Yeah. So some drawbacks, some disadvantages. You mentioned there's a learning curve.
Right, right. And for some people, it can get tiring because,
Yeah.
it involves physical work.
Mhm. Right.
Some get very good at it and can actually do, hand express both breasts at once,
Mhm.
and can be very quick. But, it can be more time consuming than double pumping if you're expressing one breast at a time.
And usually people are doing one breast at a time. And so that's another disadvantage is it takes twice as long as a double
Right,
pump, right? Because
right.
we got to do one, we got to do the other. Um, some parents also feel just uncomfortable with the idea of hand expression. And it's interesting because when we looked at antenatal or prenatal hand expression, that
Mhm.
was a predictor. Like the more uncomfortable a parent was with the idea of it, the more discomfort they had and the more they struggled with it.
And the more they
So,
struggle to get milk as well.
yeah.
So
And so,
someone's feelings about it make a difference in terms of the outcomes.
so pausing and really addressing any feelings, like if you feel hesitation, explore
Mhm.
why, what's going on. It could be that they had a history of sexual abuse.
Mhm.
It could be that they just come from a very modest community, and the idea of having your breast out and expressing is a lot.
Mhm.
It could be that it's literally physically comfortable, maybe with the hand or the breast. So we really need to, again, Nancy and I are big into the social emotional piece. And
Yes.
so if you're feeling any kind of hesitation, address that. Don't
Mhm.
just let it slide and keep going with your teaching.
Mhm.
Make sure that people are on board. And if they're not interested in doing it, that's also their choice,
Yeah.
right? So people don't have to do that. Okay, well, so when might you teach hand expressing? At what point during a pregnancy or postpartum? What
Usually,
situations?
well, it's actually these days it's recommended that all pregnant women, like who have low risk pregnancies,
Mhm.
learn during the last month, so that when the baby's born, they have the skill mastered, and so they can easily express milk in the hospital after delivery.
Mhm.
But there are people that it's especially important for, like if someone has a health condition that might delay milk increase or secretory activation after birth. One example is diabetes, and there have been a lot of studies
Right.
on diabetic mothers who learn it during pregnancy.
Mhm.
Then that would give them the opportunity to store some milk. Um, so that if their milk production was delayed and the baby needed to be supplemented, their own milk could be used.
Right, and we're going to again talk about antenatal, prenatal hand expression more later. But yeah,
Yeah,
a diabetic, baby born to a diabetic parent has a risk of low blood sugar, and they're going to want to necessarily supplement, and that's
right.
appropriate. And so, if they have some express colostrum, or actually pre-milk, what is it called now? Pregnancy milk.
Well, we in our book we're calling it pregnancy milk. I know in Ruth Lawrence's book they call it prepartum milk. So
Mhm.
we know now that the composition of the milk during pregnancy is a little different than what it will be after the baby's born.
Right, but it's still a great choice for supplementation.
Much better than cow's
Right.
milk formula for sure.
Yeah, and so during pregnancy, people should at least be exposed to the idea. It's
Mhm.
great if they can practice,
Yeah,
um, become a little familiar with the process so that they feel more comfortable. But
right,
really, the first days after birth is when this is the money in the bank. And
right,
this is what Jane Morton, this is her crusade. And, I saw her speak and she said, if we could have everybody learn how to hand express well. And after some of the feeds during the first days, just hand
Mhm.
express a bit into a teaspoon, give that to the baby as dessert. We're
Right,
going to avoid low blood sugar. We're going to avoid high levels of jaundice. We're going to avoid extreme weight loss. We're going to increase that confidence.
Right.
So that is, really those first 3, 4 days is really powerful.
Right. That's
Um,
correct.
and then, if we have engorgement, often hand expression works so much better than
Yes.
pumping. Why is
Yep.
that, Nancy?
Well, I think it's mainly because a pump uses suction and it can actually suck the swelling into the nipple and areola area and
Yep.
actually make it worse. And so the difference, of course, is hand expression uses compression.
Hmm.
And that in the beginning, when the milk is very thick, it's actually more effective at getting the milk out if you know how to do it, as compared with a breast pump.
Right.
So
Yeah.
most people would say, if someone is engorged, of course, you would try reverse pressure softening, which is a whole other issue we're not talking about today. But, if you are expressing milk, to start with hand expression because
Hmm.
you're likely to get better results that way and you're likely not to make the situation worse.
Exactly, because that pump will just pull forward that edema and make things more congested instead
Right.
of less.
And make it harder for the baby to latch and just,
Hmm.
it's difficult to get milk expressed when the edema is all in the areola and nipple area as well. So
Absolutely.
it
Yeah.
reduces the effectiveness of pumping at the same time.
Mhm. Hand expression is always part of my care plan if we're working on increasing milk as well. If we have
Mhm.
low milk volume for whatever reason, because
Mhm.
it's, again, you can do it very quickly. We often talk about every time you go to the bathroom, just have a little container, wash your hands, and do a little hand expressing while you're going to the bathroom. Because
Mhm.
milk removal is the key to increasing milk. And so it can be done quickly and frequently. So
Mhm.
it's one of my strategies that, if a family's open to it. Also, when a parent's going back to work.
Mhm.
So why would this be important, Nancy?
Well, we talked about how sometimes if you forget your pump parts or whatever, you're in a situation where you're at work and you can't pump,
Yeah.
it's really excellent to have a backup. But I think also, I mean, something we haven't really talked about is the fact that, people often talk about either or breast pumps or hand expression, but actually breast pumping works most effectively when you also use your hands.
Mhm. Yeah.
Jane Morton had a lot to do with us on understanding hands-on pumping. And so using your hands while you're pumping can sometimes increase your milk volumes by as much as 50%.
Yeah. And so just it's such a powerful thing.
Mhm.
And again, in those first days, we know that many people who struggle with low milk supply, it's because of ineffective, not as frequent as needed milk
Mhm.
expression. And
Right.
so, yeah, just slipping in some hand expressions here and there, as Jane says, it's money in the bank. It's just guaranteeing the parent's going to have a really, not guaranteeing, of course we don't, but it's increasing the odds tremendously. You're going to have
Yes.
a great supply. The baby's going to get plenty of milk.
Right.
All right. Well, so how to hand express? We have, it started ancient. I think that
Right.
people were hand expressing a long time ago.
Yes.
Um, and so it was one of those things that we had, I think, down, and then we lost it as we moved into more formula feeding in many places in the world. And now it's like, oh my goodness, this is was a lost art, especially here in the US and other like Great Britain, things like that. Um, so we're bringing it back. And so Shelley Marmette was one of the people who really brought it. And
Yes.
so Jane Morton's technique is very similar to Shelley Marmette's. And we're going to have links to videos in our podcast show notes on lactalearning.com. So if you
Mhm.
go to Lactalearning under resources, we got podcasts. So check it out. But to me, I like Jane Morton's method and I like Maya Bowman's method. So
Mhm.
talk a little bit about what Jane's method looks like.
Well, basically, it involves locating what many call the sweet spot on
Mhm.
the breast, which means you want to feel with your fingers until you find the area that when you push back into the breast, you start to see a milk flow.
Hmm.
Normally, what you do is you push back towards the chest wall and then you compress.
Hmm.
And you do that in a rhythmical way.
Right. So it's kind of like back together release,
Right,
back
right,
together release.
right.
Right. And then Maya Bowman, it's interesting because she doesn't really push back in the breast and she's
Mhm,
much closer to the nipple areola area. She's also
mhm,
looking for that sweet spot. So I think that looking for this sweet spot, the other thing that both of them emphasize is before you start pushing back, squeeze, release, whatever you're doing, prepare
right,
the breast. And so
right.
what does that mean?
That means you use massage,
Mhm.
gentle massage. I would
Gentle.
I would emphasize because
Yeah.
we know now from some of the breast surgeons in the lactation field that some women actually they think if a little massage is good, a lot must be better, and they end
And
up
we
damaging.
develop tools so we can do it even harder and more, yeah.
Right. So we
Ay, ay,
definitely
ay.
want to avoid that. The idea
Right.
is really the skin to skin contact to
Mm,
release the hormones. It's really not about putting pressure on a lot of pressure on the breast.
mm-mm,
So gentle massage, you know, and touch,
mhm.
releases the hormones of oxytocin and
Right.
prolactin that help to, especially oxytocin to help the milk flow.
Right. So take a few minutes to do some lymphatic drainage, so gentle dragging, gentle
Hmm.
touch on the breast. Maya
Right.
Bowman's really into tapping. So she uses her
Hmm.
fingertips and she taps. And again, check out the videos. And then we go ahead and we start trying to express.
Right, because you do need to prepare the breast. You don't just go right in there and start expressing.
Exactly. The other thing that they talk about is going back and forth between the breasts.
Mhm.
If milk isn't coming, then
Right,
we go back to the massage, the gentle touch, deep
right.
breathing. We need
Mhm.
to again get that oxytocin flowing because
Right,
we
because
don't want to squeeze out the milk. We want the body to push out the milk.
right.
Yeah.
And one of the issues is if you're tense or upset when you
Yeah,
are and expressing that will actually block the milk flow because when your body releases adrenaline, that prevents the milk ejection or the letdown from occurring. So it's
absolutely.
very, very important to be relaxed, comfortable, and that makes the hand expression effective.
Yeah, I remember when I would try hand expressing, even though both my babies were fully breastfed and I
Mhm.
wasn't a big pumper, I would do it like 3 times and be like squeeze, squeeze, and then I'd be like, oh, I'm bad at hand expressing. So another thing that I have learned is it can take 20 to 40 like pre-push back, squeeze together, or just to compress before
Mhm.
the milk starts flowing. So
Mhm.
patience
Right,
is important. So letting your families know, yeah, it might take a little bit to get it flowing.
right,
And then we might need to shift our hand to a different sweet spot. So this is where the art comes in and the learning comes in. And
right.
again, our attitude is really important. So having confidence, yes, milk is there, confidence in your ability to teach. I would often put on Maya Bowman's video
Mhm.
while we were learning hand expression because
Mhm.
that helped me feel more confident.
Right,
I don't know
right.
if it was important for them, but it helped me feel better.
Well, I know Tina Smiley, who was one of the first breastfeeding medicine doctors to open a clinic in the United States, she said one of our primary jobs
Yeah.
is to ooze confidence in the process, whether
Yeah.
it's breastfeeding or whether it's hand expressing.
Right, oozing with confidence. That is our job to ooze with confidence. Because, yeah, we do need to believe, you get pregnant, you birth a baby, you make milk. It's the mammal thing to do.
Yes,
And so, us having that deep conviction will spill onto our clients and help them feel more confident.
right.
All right, well, what if it's not working, Nancy? What if you're like you're practicing and it's not
Mhm.
working, especially after the baby's born? What's a trick that we could maybe do?
Well,
Um,
one might be to use some warm compresses.
absolutely. Yeah, there's research that says the warmth helps, massage helps. Also,
Right.
if we're really struggling, maybe the baby could nurse on one side
Mhm.
and then we could practice on the other side.
Because the baby will trigger the milk ejection and that will make it easier. And so, yeah, that's a great way to
Exactly.
get started. And that could be true with someone who's struggling with pumping as well.
Yeah. And again, just going back and forth, pausing and doing more massage, again, deep breathing, take it down.
Mhm.
These things are all going to help, but it is a learned art. And the more you practice, it really does, it gets better. And
Right.
so that's a good thing. All right, well, let's talk about prenatal or antenatal hand expression. Here in the US, we talk about prenatal a lot, but the rest of the world really talks about antenatal,
Yes.
and they actually call it AIM.
Well, some of the researchers use that abbreviation, AIM, antenatal milk expression.
Yeah. And
That was
so, yeah, so if you see that's what they're talking about. And as you said, this was developed for gestational parents with gestational diabetes or type 2 diabetes, where they were anticipating that maybe they might have a delay in their milk coming in, or they might have a baby who needs more volume sooner because of low sugar. But now it's really evolved into more than that. And Jane Morton, again, talk about her site for droplets, Nancy.
Well, she created a website, firstdroplets.com, that includes videos for parents who want to learn hand expression.
Yep.
And so she's got a number of free videos. Anyone can go on it and look at the videos. So if someone just wants to learn at home by themselves, then they can do that.
And this is tricky because, and this is from one of our articles, it says, however, at this writing, no major health organization offer guidelines on this practice. Many,
On AIM, right?
and many healthcare providers are unfamiliar with it. For this reason, many mothers are learning about it. Where, Nancy?
On the internet,
On
of
the
course.
internet. Yeah.
Social media, yes.
Right. And so they're looking at it and they're seeing it. And so that's we need to be
Yes,
knowledgeable because
right.
there are cases where maybe we shouldn't do hand expression
Yes, that's
during pregnancy. So talk about those exceptions, and they're pretty rare.
well, I mentioned that if someone has a low risk pregnancy, then it's
Mhm.
considered acceptable.
Mhm.
Um, I think the main reason why the studies on this started was because there was a great fear that if
Mhm.
you use hand expression at the end of pregnancy, you're going to trigger labor
Yep.
early. And
Yep.
that's what the very first study that was, major like randomized control trial with diabetic mothers, the DAME study from 2017 looked at, where they divided the mothers into two groups, and some of them, they all had diabetes, but
Mhm.
some of them learned hand expression and practiced it, and the other group didn't, and they found no difference in pregnancy outcomes. And in
Right.
fact, one hospital that I was helping at one stage, they said that they recommended hand expression to mothers at the end of the pregnancy to try to bring on labor. And I asked them the question, "How's that working out?" They said, "Well, actually, we've never had a case where it
It's
worked."
never worked. Right.
So yeah, that was sort of the old thinking, was that this would do that. But on the other hand, I mean, when we look at nursing during pregnancy, we don't see that either. And as a matter of fact, the same hormone that's released during breastfeeding or hand expression is the same hormone that's released during sex. And so I think a good rule of thumb is that if you're not cautioned against having sex during pregnancy, then
Mhm.
it's probably fine to go ahead and learn hand expression at the during the last month. But if on the other hand, if you have a high risk pregnancy, then probably it's not a great idea. So that would
Right.
be one situation where it would not be recommended.
Or if you start doing hand expression and start having strong contractions,
Right.
it's stop, right? And so you should be talking to your healthcare provider about this as well. But yeah,
Mhm.
the oxytocin levels that you reach if you're having an orgasm, during sex are higher than
Yeah,
what you would be triggering with hand expression. And
right.
so sometimes people refer to this as pelvic rest. So if you have a
Mhm.
history of early labor, if you have a high risk pregnancy,
Right.
it needs to be in the last, I think it's 3 weeks of pregnancy, Nancy, that they say 37 weeks and on.
Yeah.
Um, so, you just want to just keep that in mind. But we have had several studies that have confirmed that it seems to be quite safe.
Right. It's the same as continuing to nurse during pregnancy.
So
Yes.
one of the things that we had hoped is if you did prenatal hand expression, your milk would come in sooner and
Right.
faster.
Yes.
True
And
or
that
false, Nancy?
False, false.
Yeah.
We have multiple studies now that have looked at that, and there
Yeah.
has been no indication whatsoever that practicing hand expression during pregnancy causes an earlier secretory
Right.
activation or, milk, as people say, coming in. So
Right.
no, that does not seem to be the case, at least with what we know now.
Right. The supply seems to be more robust. So when it comes in, it's like
Mhm.
there's a little bit more, but it's not, it doesn't
No,
make it
actually,
faster.
actually, they weren't finding that either, at least in the
Oh,
studies that
really?
I looked at. Yeah. So it
Hmm.
doesn't really seem to have a major effect
So
of
it's just
any
really
sort.
being able to giving that confidence and providing that food to the
Right.
baby other than formula.
Right, right. The main purpose is really for most people, like if you're not diabetic, if you're not high risk for needing to supplement in the early days,
Mhm.
the main focus should just be on learning the skill and getting good at hand expression and not really worrying so much about, collecting and storing milk.
Let's talk about that
Yeah.
because learning the skill is one thing, right?
Hmm.
That's going to boost your confidence. Not everybody needs to collect the milk.
Right.
But
Correct.
unfortunately, and if you're diabetic or gestationally diabetic, then it becomes important. A couple of caveats with this, you want to be collecting it in a clean container and storing it properly. And so
Mhm.
there's information about that. But then some hospitals don't have protocols or
Right.
plans.
Right.
So
So
what do we need to do?
there were a couple of studies actually in which the mothers were collecting their milk during pregnancy and freezing it. And when they brought it into the hospital, the people in the hospital refused to use it. They had no protocols for it. They had no place to store it.
Right.
And many times they even mishandled it to the point where it was impossible to use it. And so before someone decides they're going to store their milk, a really good first step would be to contact the hospital and make sure that any stored milk they bring to the hospital is going to be able to be used. Because
Yeah.
it would be, I mean, you can imagine how that
Tragic.
felt about that. They just felt horrible that they had put all this effort into it and they were attempting to be, as they felt, good mothers to
Mhm.
provide only their milk for their baby. And yet these babies still got formula because the hospital, could not figure out a way to use their expressed milk.
Exactly. The other thing that you just told me about, Nancy, and I'm not surprised because we're struggling with this.
Mhm. Mhm.
Anxiety in general is
Yes.
rampant. But so
Yes.
tell me, what did you find out just recently?
Yeah. So when I spoke in Australia, it was just about exactly a year ago. I had a lactation consultant come up to me, and others told me the same thing, was that they're finding that many mothers are discovering antenatal milk expression on the internet, and they're approaching it with a vengeance, and they're like so over focused on expressing and storing milk during pregnancy that the lactation consultants were very concerned about their mental health. They felt like, some mothers were becoming like almost obsessive about this, and they felt like it was a negative because, the mothers seem to be suffering over this issue,
Mhm.
which is unfortunate because, as I say, for most mothers, the storing is not really the important part. The main idea is to learn the skills so that when
Right.
your baby's born, you can, follow nursings by expressing the colostrum into a spoon and giving the baby the dessert. It really isn't about having a lot of stored milk.
Right. But again, people know, oh my God, I might not have enough milk, or oh my God, my
Right,
baby's going to be at risk of formula and supplementation, and
right,
I don't want that. And so they're
right,
so scared,
right.
because when we're talking about prenatal or antenatal hand expression, we're talking about like 1 to maybe 4 times a day. Or maybe even every other day.
Once or twice a day, is I
Yeah.
think is usually suggested.
Hmm.
Uh, but yeah, it's not something that you should be over focusing on for sure.
Yeah.
But
So,
I have to say, when my grandson was born 3 years ago, I was worried about whether they were going to supplement with formula in the hospital. I went to our local milk bank and purchased frozen donor milk just in case. So I understand that anxiety. And a
mhm,
lot of places, where there's milk banks, that is an option as opposed to, driving yourself crazy by trying to store a lot of colostrum.
right, right. And again, though, you want to check with the hospital to make sure they have a way to
Right,
handle that
right,
donor milk so
right.
that it can be used. Well, Nancy, thank you for this discussion. I
You're
think that
welcome.
hand expression is very handy for us to have. And so, yeah, we appreciate you coming on All Things Breastfeeding.
My pleasure, Barbara.
If you're enjoying All Things Breastfeeding, we would love for you to go and leave us a review on your favorite podcast listening device. If you have any topics or anything you would like to us to discuss, please just email Barbara at Lacta Learning, and we're happy to consider it. Thank you so much for listening today.
Bye bye.